The United States could put an end to this pandemic worldwide without sacrificing a single dose of vaccine to Americans. All we need to do is give countries around the world permission to manufacture these vaccines by sharing the patents and know-how with everyone. The ball is now in President Biden's court. On May 5th, countries that are signatories to the World Trade Organization will be gathering. The president can decide to share these patents with the world. And the only thing stopping us is not what's best for the American people, but actually what's best for Big Pharma. Wealthy countries around the world, the EU, Japan, the United States, have purchased the lion's share of available vaccines that are produced by Big Pharma companies.
The United States and other wealthy members of the World Trade Organization have blocked a proposal to waive intellectual property rights related to COVID vaccines.
They say waiving the patents would put off private investors and slow down scientific innovation.
But there is a way out of this conundrum. Countries like India and South Africa can mass produce vaccines. In fact, they already do. They want to manufacture vaccines enough to end the pandemic everywhere. Because unless we end the pandemic in every corner of the globe, it is not safe for Americans, and the global economy will continue to be stilted. That's dangerous for everyone. By sharing the patents from Moderna and Pfizer and the know-how so that India and South Africa, makers of vaccine, will be able to mass produce the billions of doses needed to end the pandemic. Right now, the biggest barrier to scaling up vaccine around the world is the U.S. opposition to a TRIPS waiver.
And WHO believes that this is a time to trigger that provision and waive patent rights. Those provisions are there for use in emergencies. If now is not a time to use them, then when?
We've seen this before. In the AIDS pandemic, a public movement of people living in the global north, living in the global south, standing together and saying, we have a right to this therapy as a public good. We fought for the United States not to enforce the TRIPS waiver in the WTO meeting in Doha in 2001. And when the US backed off that TRIPS waiver, generic production of the antiretroviral started. And the price for those drugs before that conference was $10,000 per patient per year, and today it is less than $60,000. And almost all of the 27 million people around the globe who are on antiretroviral therapy are on it for free. This is what we need to happen with the COVID vaccine. We need the US government to back off on enforcing TRIPS and allow massive manufacturing at scale by companies in a generic fashion. And time is of the essence. We see that the new variants of COVID-19 are spreading more rapidly. And so we are in a race against time around the world. And the very variants that are starting elsewhere are coming to the United States. We're begging the Biden administration on May 5th at the World Trade Organization meeting to back off on enforcing TRIPS for the COVID-19 vaccine so that we can have the mass production of the billions of doses needed to vaccinate the world, which is good for the world, it's great diplomacy, and it will end the pandemic everywhere.